My name is Katie. I am 24. I've been married for 6 years in February and have 2 children who are 6 and 3. My story, my journey, let's say, started on the 1st of January 2012. I started spotting. I wasn't due on, and my immediate reaction was, I'm pregnant. Me and my husband were trying for a third baby. So I went and done some 4 pregnancy tests. The first 2 were negative, the third was positive, and the 4th was negative. So immediately I went to my GP and he said, well, it's got to be, you've got to be pregnant, you might be losing it. Go home, if the symptoms don't ease up, we'll arrange a scan for you. So I went home and gradually the bleeding was getting heavier, so I went back. He then referred me for a radiology scan, and they took them 3 weeks to say that they didn't think that I needed a scan. So he then referred me for an ultrasound in Women's Health, an internal and an ultrasound. And it wasn't due till the 2nd of March. By the end of January, I was bleeding really heavily. You imagine a normal menstrual cycle, you times that by 3, and that's what I was getting. On the 17th of January last year, I said to my husband, this is cancer, and I know it is. And he said, don't be so stupid, that's ridiculous. By the end of January, I'd lost so much blood. My friend had to rush me to A&E where I saw an on-call doctor, and he said that I had a fever and my right gland in my pelvis was swollen, so automatically I got pelvic inflammatory disease. So he gave me tranexamic acid, which stops bleeding, and antibiotics for pelvic inflammatory disease. He then said, I think you should go to the sexual health clinic. And I sort of looked at him stunned, thinking, well, why would I need to do that? I've been with my husband for 5 years. At this point, but the following day I went anyway. He examined me and he said that there was too much muck there to do a proper visual internal examination, but he done swabs. He said by looking at it, I had a sexually transmitted disease, and I said, I can't have, I've been married 5 years, and he said, well, I'm sorry to tell you this, but your husband's been playing away. You can imagine the argument when we got home. But my husband was gobsmacked, and he said, I will go for any test that they want me to do just to ease your mind that I've not done that. And he did, and it come back all clear, and that's how we settled that one. I was going to and fro to the doctors every 4 days. Once I got my medical notes through in May, it actually said on one of my doctor's strips, I don't know why she's bothered to come. I was told it was pelvic inflammatory disease twice. I was told that it was an abnormal menstrual cycle, but that was going on for 4 months. I was told once that it was in my head. Anyway, I went back in. I went back on the 6th of May, and I saw a different GP. I asked for a different GP. At this point, as you can imagine, I'd lost 5 months worth of blood, and I was very ill. It was very hard for me to stand up. My vision had gone blurry. I couldn't move. Bearing in mind, I also had 2 children to take care of. And this doctor says, we'll just fit a coil and it will be fine and it will sort it out. But because you've been diagnosed with suspected pelvic inflammatory disease, the coil will counteract the pelvic inflammatory disease will counteract the effects of the coil. So you'll need to go for a hysteroscopy. which is a camera and water, basically. So I got that appointment through on the 29th of May, and the gynaecologist done it without any anaesthetic because I chose not to. I'm needle phobic, so I can't have any injections. True needle phobic. I'm not scared of needles. It's just a switch in my head. So he done it without any anaesthetic, and he said that he couldn't. There was something blocking my cervix, and he couldn't get past it. He took me out. He finished up. He took me out and sat me on the bed, and he said it could either be a ruptured fibroid or cancer, which anyone in medical terms will know that these are at the other end of the scales. They're so far apart, it's unbelievable. But he'd need to refer me to a higher consultant. So he arranged me an appointment for the following week. That was on the Friday. My next appointment was on the Friday, and on the Wednesday I got up one morning and I collapsed, and there was blood everywhere, and it just wasn't stopping. Luckily my parents had my children and they wasn't there to witness that, but my husband picked me up and put me in the bath and called an ambulance, and they took me in. I had 2 gynae doctors examine me, and they said the cervix looks abnormal, but because I've had children it's going to look abnormal anyway, so there shouldn't be anything wrong. I stayed in overnight so they could settle the bleeding, and I went for my appointment on the Friday, and she arranged for an EUA, which is an examination under anaesthetic. And whilst I was under, they would put a PICC line in, which is basically a really long cannula that goes from here up to an artery in your heart, which can stay in for up to 12 months. So I wouldn't need any injections. And we sat there in the meeting, and I said, could this be cancer? And she said, no, I don't fit the criteria. I'm not old enough to have cancer. It's probably just a odd menstrual cycle, and young women go through this. So we just left it. I knew in my heart of hearts, I knew that it was cancer. They done the EUA the following week, and I come round to being an inpatient, and she come in and sent everyone out, which then I knew that it was going to be very bad news. And they said, unfortunately, it is cervical cancer. It's very aggressive, and my tumour was measuring 9 by 9 by 6 centimetres, which is basically taking the whole right side of my cervix. I went down to see my consultant, and he said that because it was very aggressive, they had to start radio chemo the following week. He said, but had it been picked up on the scan in March, which it was only measuring 4 centimetres, they would have been able to take it out and just give me a bit of radio. So even though in the scan in March, when my husband actually asked the nurse, can you check, because she's worrying that it's cancer, and the nurse checked and said no, it's fine. In actual fact, had she had a specialist look at it, they would have found it then. I went through 6 weeks of intensive radio and chemo. I also had brachytherapy, which is internal radiotherapy. Wouldn't wish it on my worst enemy. It's like a 70s torture chamber. I had to have it twice. It's basically metal rods going up, and you're immobilised, you have to have a catheter, and you can't move, and it stays in for about 24 hours. You can imagine at 24 not being able to move and having to be bed bathed by someone and having to have your family watching on you doing that, and your 5 and 2-year-old having to come and visit you whilst you're having that. It's not very nice, but it all had to be done. There was plenty of times which I gave up and I refused treatment, and my husband physically threw me over his shoulder and took me to the hospital and put me on the chair and said, "Don't be so stupid." So a lot of me standing here goes to him, because I wouldn't be, because I'm quite stubborn when I decide not to do something away. After all that, just before Christmas, they done a scan and said that the tumour had shrunk to 1 centimetre, but it was now on the left side, and there was a lymph node that was just showing up underneath, but they was happy with the progress and it should come down fine. They said just for peace of mind, they'll do a PET scan, which is they put fluid in and it lights up any problem areas. They done the PET scan, and unfortunately the tumour was very still active, and so was the lymph node. And they said, "Okay, we'll follow you up in January and refer you to the Royal Marsden, which is one of the best cancer hospitals in the UK, and see what they say for a fresh pair of eyes, see if there's anything else that they can do." Unfortunately, on the 17th of January, I got called in, and my tumour has grown again. It's now 3 centimetres. There are 3 lymph nodes that are infected, and both my ovaries. The Royal Marsden can't do anything, so I am now having chemotherapy just to try and maintain it for as long as possible. I have to believe that me going through this has some bigger picture, and if me sharing my story can help someone not go through what I have to go through, then I've achieved what I wanted to. And if it saves a family and a 6 and 3-year-old having to lose their mum at such a young age and not understand where or why I've gone, then that will make me feel better. But yeah, I do urge anyone to be very forceful if they have any symptoms, because I was ignored and it could have been averted for me being in this position now. So